Dr. Mridu Sharma, Associate Professor and HOD in Panchkarma Department of Srimati Urmila Devi Ayurvedic College, Hoshiarpur, welcomes you all on the 14th day of Ayush Vibhodhini 2. This series is a vision of our respected chairman, Engineer Amarjit Singh Walia, for the upliftment of Institute, which is carried upon successfully by our principal, Dr. Meenakshi Nath. She is an inspiration for all of us in every way. So before starting the next event or session, I'll request our principal ma'am to please share a few words with us. Over to you, Meenakshi ma'am.
Okay, thank you, Dr. Midhu. Good morning, everyone. Myself, Dr. Meenakshi Nath, Principal Srimati Urmila Devi Ayurvedic College, Hoshiarpur, welcomes you all to another remarkable session of Ayush Vibhodhini Series 2. This series is being conducted by Srimati Urmila Devi Ayurvedic College in association with Sri Dhanvantri Herbals, Amritsar. I am very thankful to our esteemed chairman of Engineer Amarjit Singh Jiwalia for their continuous encouragement to do such events. And I am also very much thankful to our Vice Principal, Dr. Mridu Sharma, and coordinators of the series, Dr. Deepika, Dr. Sonika, Dr. Pooja, and Dr. Jyoti for their commendable efforts for this ongoing webinar series. For today's lecture, I welcome Dr. Asma from SBSS Krishna Ayurvedic College and Hospital Sankeshwar with her topic, Importance of Panchkarma in Psoriasis. We all know psoriasis is a tedious disease to treat, and in modern, the treatment is not that much capable. So Ayurveda is the ray of hope, and it surely pacifies psoriasis. To get a sure shot formula of success in psoriasis, let's welcome again Dr. Asma. Thanks, Dr. Asma, for accepting our invitation and sharing your knowledge with all of us. Now I invite Dr. Midhu again to coordinate the session further. And one thing I want to say, Dr. Asma, Dr. Midhu is very much excited and happy to have you on this platform. Thank you so much. And good morning, students. The students of, I think the students of your college, ma'am.
Yes, ma'am. They are also joined.
Okay. Thank you so much, ma'am. Thanks for your approval. Dr. Midhu, please carry on.
Thank you very much, ma'am. Now, before I introduce you to our guest speaker, I would like to take a moment and appreciate the teaching staff of our college who not only participate actively but very efficiently on a very short notice. Our young coordinators, Dr. Deepika Minhas, Dr. Pooja Thakur, Dr. Jyoti Saro, and Dr. Sonika Jaryal deserve a great applause as it was their first event and they have managed it so well. Whether it was an arrangement or execution of any webinar event, they totally took the charge and completed it with success and with great zeal also. Thank you. We are looking forward for this cooperation in future too from all of you. Now it is time to introduce our guest speaker of the day, Dr. Asma GABBUR, who is very dear friend of mine. We were batchmates in our PG and since then she had immense interest in Ayurveda and Panchkarma. There are many feathers in her hat, but to mention specifically, she is working as Associate Professor and HOD in SBSS Krishna Ayurvedic Medical College and Hospital Sankeshwar. She has been practicing Ayurveda since 10 years and is specialized in treating infertility, hyperacidity, joint disorders, cosmetic issues, etc. She has done concentrate course in Panchkarma and special therapies of Kerala from Ernakulam. She has done certificate course in Ayurvedic cosmetology from Pune and she has been awarded as COVID warrior by COVID Information Center and she has managed COVID very efficiently. She has treated and cured more than 1,000 patients of COVID through Ayurveda. She has attended many national and international seminars and published research articles on the role of Shashti-Shali Pindaswed and CP child and many more to come. Welcome, Dr. Asma, and thank you for accepting our invitation. I'm sure your knowledge will be very beneficial to our delegates and students. Over to you.
Good morning, all. Thank you so much. First of all, I would like to thank the chairman of Srimati Urmila Devi College and Hospital, that is Mr. Amarjit Singh Walia, sir, and the principal of your college, Dr. Meenakshi Nath, ma'am, and the Vice Principal, that is Mrudu Sharma ma'am, for giving me this opportunity to have a discussion on the very important topic, that is the psoriasis, which is in allopathy we don't find any of the hope for the patients of psoriasis. So can we start with the topic, ma'am? Can you share the PPT, ma'am?
Okay, is it visible?
Yeah, yeah.
Okay, okay, you can start.
Make it a slide on the slideshow. And start the PPT.
Okay, slideshow is visible.
Now it's visible.
Yeah.
Okay. Good morning, dear students. Today we are going to discuss about the importance of Panchkarma in psoriasis. So we know psoriasis, it is a very deadly disease, and we don't have any hope in allopathic medicine, that just what they will give, what they will prescribe. Everyone knows that they give only the steroids and everything. So before understanding about the Ayurvedic concept or the treatment or the Panchakarma theory of Ayurveda, first let's understand what is the psoriasis. What happens exactly in the psoriasis? Everyone know the psoriasis is a autoimmune disorder. Okay, so what happens? What exactly happens in the body that it becomes a autoimmune? Because see, the autoimmune, it is a chronic disease where the body's own cells, they try to kill the normal skin cells of the body. So in an order to repair that the damage caused by the your immune system, our body cells, our skin cells, they try to develop more rapidly than the normal. Usually, the new skin cells, they develop approximately, they take 4 weeks to develop the new skin cells on the body. But here, in case of psoriasis, what happens? The specialized white blood cells, those are called as the T cells, they try to mistakenly, they try to kill the normal healthy skin or the healthy cells of the body. So in an order to responding in that order, the inflammation or the skin becomes red, and because of that, our body or the immune system or the skin cells of the body, they try to develop new skin cells more rapidly than the normal. That is, the growth of the skin cells, it becomes so fast that it is faster than the 10 times, even though it won't give time for the old cells to shed off. Okay, so just understand the concept of psoriasis. Here the skin is normal. Okay, but what happens in psoriasis is our immune system, it is trying to kill your normal skin cells. Okay, when your normal skins are destroying on a faster rate, your normal skin cells, they try to develop very fast, or they try to reproduce very fast. Okay, faster than, that is 10 times faster than the normal, even though the your old skin cells or the WBCs, whatever they are there on the skin, they don't get time to shed off. So they just move on to the surface of the skin, causing accumulation on the skin surface, leading to the plaques. That's why in case of psoriasis, the skin cells, they create the thick scaly patches called as the plaques. Okay, so the patient with the psoriasis, they develop the plaques or the patches on the skin. Especially you can find these patches on the elbows, knee, scalp, palms, and soles, etc. It is associated with severe itching, pain. The area is inflamed, red, or
Dr. Asma, you are muted.
Your connection is lost, Dr. Asma.
now I'm audible, ma'am.
Yes,
Yes.
yes, you are audible. Yes.
Till now it was mute.
Yes, ma'am, you
Just
were
now,
mute.
just now.
Just now, okay. Okay, I think the concept of psoriasis is clear to everyone. What exactly happens in the psoriasis? Of course, there is a red patches, scaly skin, silvery white lines on the skin. Why this is happening? Because of the autoimmune response of the body. Next comes the causes of psoriasis. As everyone knows, the exact cause of psoriasis unknown. It is there is no any particular cause for the psoriasis, but there are some factors or the triggers which precipitate the psoriasis. So here in the picture you can see these are the triggers for the psoriasis. The very first one is the medication. Medication in the sense if the person is taking the medicines for a longer period, then it may precipitate the psoriasis. The medicines, for example, it may be the beta blockers, it may be the anti-malarial drugs, it may be the Inderal, indomethacin, etc. These are the drugs which are responsible for the triggering the psoriasis. So immediately after taking the medicine, the patient won't represent the psoriasis, but in a course of time when the patient is continuing the medicine for a longer time, it may lead to the onset of psoriasis. Second is the skin trauma. See, in the skin trauma, here it works on the Cobner's phenomena where even a tiniest pinprick may precipitate the psoriasis. That is, it may also take 10 to 20 days. Any injury, any rub on the skin, any of the animal bite, even after they are doing the any tattooing or taking the vaccination, it may precipitate the psoriasis. So here it works on the Cobner's phenomena where the scales they spray if the person is usually it is seen in the psoriasis, not only in the psoriasis, but we can find this kind of Cobner's phenomena in every of the skin diseases. Okay. So here, suppose a patient is there with the psoriasis, and if there is if the Cobner's phenomena is active in that person, then if that person, if he just shave his beard or only a teeniest pinprick or just a rub on your skin, that may precipitate the onset of psoriasis, or there may be the more flares or patches of psoriasis on the other part of the body also. Suppose a person is having a one patch just on the forearm, because of this phenomenon, immediately after 10 to 20 days, after the skin injury, the person may get the patches on the other part of the body also. Okay. Next is the alcohol. Alcohol actually, there is no any direct link.
Dr. Asma muted again. Dr. Asma, you are muted again.
No, ma'am, it's here. It's audible here.
Okay, okay. Now it's audible.
Okay. So I think ma'am, the PPT, please. I'm not able to see the PPT. Am I audible now?
Yes, you are audible. And PPT is working. Are you not able to see it?
No, I'm not able to see the PPT. Okay, fine. Just I will explain the causes of the triggering
No,
factor.
no, I'll share it again. Just give me a moment.
Okay.
Yeah. Is it visible now?
No, ma'am. Okay, fine. Yes, now
Is it
it's
visible to some other person? Can you please tell me?
now it's visible to me also.
Okay, okay, okay.
Okay, the previous slide, ma'am. Yes. Yes, we are discussing about the triggering factor related to the alcohol. So alcoholic person may precipitate, the person who takes the more alcohol may have the psoriasis, but the direct relation of alcohol and the psoriasis is not known. Next is the stress, which is a very important factor in case of psoriasis. The stress and the psoriasis, they run hand in hand. When a person which is under anxiety or the stress, it precipitates the psoriasis. And if a person is having the psoriasis, because of the psoriasis, the person may also undergo into stress factor. So these two are very interrelated, and if the stress is more, the it triggers the more psoriasis. And if the psoriasis is present in someone, then that person is definitely the person is under the anxiety or the stress. Next comes the obesity. Obesity, here also there is not that much data present that how the it triggers the psoriasis. But of course, the person who is more obese, definitely they precipitate or that it triggers the psoriasis. Next is the genetic predisposition. We know that the psoriasis is a genetic disease also. It runs in the family. If someone, if any ancestral person in the family is having the psoriasis, the next generation person may also have the chance of getting the psoriasis. It occurs because of the gene mutation. Now, very new research has been carried out that a new, very rare genetic mutation named as the, I think it's card 14, which where they have shown that card 14 genetic mutation, it is leading to the, or it is precipitating the psoriasis. Next is the endocrine diseases. Endocrine diseases here, exactly, I think it's the only the sexual hormones or the prolactin levels in the body, they may act as the precipitating factor for the psoriasis or the triggers for the psoriasis. Any change in this hormone, or not only this, apart from this, the other hormones like the glucocorticoids and the insulin and some other hormones are also responsible for triggering the psoriasis. And next is the infection, that is the infection of the throat by the streptococci, etc. These are representing, or they are triggering the psoriasis. Okay, these are the modern causes which work on this factor. Okay, next comes the symptoms. Symptoms, everyone is well known about the symptoms. The person presents with the red patches on the skin which are very itchy. The skin is very cracked, dry. Sometimes you can see the small spots on the skin, usually seen in the children's. The patient complains of severe body pain or severe joint pain, inflamed joints, or there is a thickened nails or a painful. Sometimes the nail may also follow. These may occur in case of chronic psoriasis or in case of psoriatic arthritis, when the psoriasis is present in the body for more than 10 years. Then the person may complain of soreness, that is myalgia, and the swollen joints and painful joints, and this thickened nail, and everything we can find in each and every type of psoriasis. So the only the thing what you, when you see the patient, just after examining, see, there is no any particular test for the psoriasis or any diagnostic tool for the psoriasis. Only after examining the patient, looking into the skin, you can rule out whether it is a psoriatic or some other skin condition of the disease. Okay, next. Next comes the types. So here the types are very important, because it in allopathic, in modern science, and the psoriasis varies according to the its presentation. Okay, the next slide, ma'am. The psoriasis, it is actually of 7 types, 7 to 8 types commonly seen in the patient. The very first is the plaque psoriasis, which is very, very commonly seen in more than 8 patients out of 10. It is very commonest form of psoriasis. Next is the gutted psoriasis. Next, the inverse pustular, erythrodermic, scalp psoriasis, nail psoriasis, and also the psoriatic arthritis. These are the 7 to 8 types of psoriasis. So just we'll see in brief what is each and every type of psoriasis. The very first is the plaque psoriasis. Ma'am, slide please. Next slide, ma'am. Okay. So in the picture, it is clearly seen what is the plaque psoriasis. Plaque means the previous one, ma'am. Okay. It is a very commonest form of psoriasis. It is commonly seen in many patients. That is, most of the patients they present with this type of psoriasis. It is also known as psoriasis vulgaris. Here, what happens in this disease, in this form of psoriasis, is the skin it becomes inflamed, red. There is a white silvery scales on the skin. The person presents with severe itching, and some after itching the person may also complain of the burning sensation. These plaque psoriasis, especially it appears on the elbows, the knee, trunk, the scalp, etc. Okay, I think the plaque psoriasis is very clear to everyone. Whenever a patient presents in front of you, I think all of the students who have joined here, they belong to the fourth year, and the fourth year is the phase where you will come to know the means you are direct in contact with the patient, you have the conversation with the patient. So just try to understand the concept of plaque psoriasis, because the diagnosis is very important. When the patient, if the you can it just if you see the this type of flakes where it is very dry, if the patient complains of itchiness, when it comes in the patches in different parts of the body, it is present on the elbow or in front of the leg or on the trunk, sometimes on the back also, and sometimes it covers the scalp, then immediately you should diagnose it as the plaque psoriasis. Okay, next. Okay. Next form of psoriasis is the gutted psoriasis. This is commonly seen in the children and the young age group people. It is present in very less cases. That is only 2% of the cases we can see the gutted type of psoriasis. Here you will find a very small red color spots on the skin. Usually it is present on the trunk, upper arms, thighs, and the scalp. So it is very, it may go in a few weeks. There is no any treatment required for this type of psoriasis. But when it becomes stubborn, when it stays in the body, then it at that time you have to give the treatment for that kind of patients. Okay. So the gutted psoriasis, remember, the gutted psoriasis, it is commonly seen in the young age group people and in the children. Just a very small pink color spots are seen on the body. Then you have to differential diagnose it whether it is a, plaque psoriasis or whether it is a gutted psoriasis. छोटे छोटे dots जब शरीर पर आ जाते हैं, then at that time you have to just think of the gutted psoriasis. You have to wait and watch whether it will disappear on its own or no. If it stays in the body for a longer time, then you have to give the treatment for this type of psoriasis. Next. Next slide, ma'am. Okay. The next type of psoriasis is the inverse psoriasis. See, this psoriasis, it is found in the areas where you sweat more. Okay, where there is more sweating in the particular parts of the body, there you will have this type of psoriasis. For example, the armpits, the groin, under the breast, skin fold under the genitals, and the buttocks. Okay, so these are the areas where you find the inverse type of psoriasis. See, in this type of psoriasis, you will just only find a red color patch which is smooth and shiny. Here in this type of psoriasis, you won't find any of the scales. Okay, everyone knows that the psoriasis means the skin becomes thicker, there it is extremely dry, and ऊपर से it just looks like the scales of the fish, and वहाँ से dandruff गिरता है. Yes, it is seen only the one type of psoriasis, that is the plaque psoriasis. This is also a psoriasis, but it is the different one. It is an inverse type. Here you will find just a patch, a red color patch, which is shiny, which is smooth, and here we won't find any of the scales. And this condition, it get worsen with the sweating and the rubbing. Means the person sweats more, the inverse psoriasis increases. If the person just rub the skin vigorously, that when there is increased friction on the skin, then also it triggers the inverse psoriasis. That is the triggering factor for the inverse psoriasis. If we see, it is the friction or the rubbing on the vigorously rubbing the skin with the anything, with your nails, sometimes nails, or some may use the comb or some other hard objects just to make the itch. Okay, next is the sweating and sometimes the fungal infection. See, this type of psoriasis, it may be mistakenly taken as the fungal infection or the tinea infection of the skin. Next is the pustular psoriasis. It is a very rare disease, very uncommon disease. Commonly it appears in the adults. Here you will see the pus-filled bumps surrounded by the red skin. I think the picture is visible to everyone. Just see, there are the small bumps of pus present on the palmar surface of the hand on the heel region, and the surrounding area, it is reddened or it is inflamed. Okay, so when the person is having this type of pustular psoriasis, the patient should get hospitalized when it covers the complete body. Usually it is present on the hands and the feet. When it acquires the complete or it covers the complete body, then it becomes a serious condition. Then at that time the patient has to get admitted in the hospital and he has to take the treatment. When it completely acquires the body, then it is called as the generalized pustular psoriasis. Here the symptoms include, see, when there is a pus formation in the body, of course, then of course there is a inflammation present. When there is a inflammation in the body, then you should think of the fever, chills, tachycardia, muscular weakness, and the sometimes the person complains of the nausea. Okay, so in the pustular psoriasis, it is very painful disease where the pus on the small bumps of the pus is present in both hand and feet. There that requires the treatment. Patient complaints of, means associated complaints are the pus, sorry, and the fever, chills, and tachycardia, that should be managed accordingly. Here also, the triggering factor, what causes the pustular psoriasis to occur? What are the triggering factors for this type of psoriasis? It is sudden stopping the medications, for example, any of the topical medication. See, in the modern science, any skin disease, it may be psoriasis or any of the, there are so many varieties of skin diseases are present in the modern science. Okay, so all those diseases, the only the line of treatment for the skin disease is the topical application, or they will prescribe the steroids. So what precipitated the pustular psoriasis is, if the person, if he was already he was suffering from the psoriasis and he was taking the medication for the years together, after because of the tiredness of for taking the medicine, if the patient suddenly stops taking the medicine, that is the steroids, if he stops suddenly, then this type of pustular psoriasis may get precipitated, because that is the triggering factor for the pustular psoriasis. That is topical applications or the systemic medicine for the psoriasis, and also the steroids. Okay, and next is getting too much of UV light without using the sunscreen, or the another treatment method, or the another method of treating the psoriasis according to modern science is the laser therapy or the light therapy. Excessive exposure to the UV rays may also precipitate the pustular psoriasis. Any infection or any exposure to the chemicals may also triggers the psoriasis. Next slide, ma'am. Next slide, please. Okay. After looking into picture only, I think everyone is just key. What is this? Okay. See, this is the erythrodermic psoriasis. Here, the patient, it is very least common, but it is very serious. Okay. See, just look at that old man. His complete body has been covered with erythrodermic patch. What is erythrodermic patch? What happens here? See, it affects or it covers almost or widespread completely on the body. The skin, it looks fiery and appears burned. Means when we look directly without just only when we see a new patient, immediately we'll see no, maybe he had some burns, maybe the electric burn or some other kind of burn he might have undergone. That's why the skin has become like this. But here, the erythrodermic psoriasis, it is a very serious illness, and it is very least seen in the patients. Okay, the complaint, the patient present with severe itching, burning, and a peeling of the skin. The very important symptom in this type of psoriasis is the peeling of the skin. Just your skin sheds. Okay, the upper layer of your skin starts to shed. There is a tachycardia, and the patient comes complains of fever on and off. Fever आना है जाना है, यही यहाँ पे means that is the main symptom that the the patient says ke only daily I'm having the fever, sometime it comes, sometime it goes. Here, this type of psoriasis, it should be managed in the hospitals, because the condition of the patient may get worse because of protein and fluid loss. Sometimes the patient may get the infection, the pneumonia, or the congestive cardiac failure. Okay, so this is a very serious illness. It should be managed accordingly in the hospital after complete taking the precautions. The patient should be managed. The triggering factor for the erythrodermic psoriasis is same as of the pustular psoriasis, sudden stoppage of taking the systemic medicines for the psoriasis. It may also occur to any allergic reaction to any drug, the severe sunburn, any of the infection or any of the medications may precipitate or triggers the erythrodermic psoriasis. Next, ma'am. Nail psoriasis. Okay, see, the nail psoriasis, in each and every type of psoriasis we will see the nail changes. Okay, but it is commonly seen in the psoriatic arthritis. What are the symptoms that can be find in the nail psoriasis is there you can find the pitting of your nails. Sometimes the nails, they just shed off from its base or from its that is the nails or the base of the nail. Next, the color changes, it becomes the yellowish in color. Sometimes the chalk like material, it just fall off from the nails. And here the patient with the nail psoriasis, they are more likely to have the fungal infection of the nails also, and it is very painful. The patient complains of pain in the nails, some dandruff or the chalk like material is pouring from the nail, there is a pitting of the nails. So these symptoms are seen in the psoriasis. Okay, nail psoriasis. Next, ma'am. Next slide, please. Okay, and the last but not the least, that is the psoriatic arthritis. See, in the psoriatic arthritis, here the psoriasis and the arthritis, they run side by side. Okay, you can find the symptoms or the signs and symptoms of psoriasis also. You will find the symptoms of arthritis also. Just see the changes in the nails. It will not happen in an infection of any 1 day, 2 day, or a month or a year. It has to take a longer time to develop these type of changes in the bones. Okay, that is, if the psoriasis is present in a person for more than 10 years, then only the person will have this type of psoriatic arthritis. So what are the complaints of psoriatic arthritis? See, first of all, the person is having the psoriasis, of course, but when the patient complains of the severe pain in the joints, when they are inflamed, and swelling in the fingers and the toes, and it just the stiffness of the joint is present, which is which becomes worse in the morning and at rest or in the cold season also. In the early morning there is a more stiffness. The patient just can't fold his or her hands. Just extremely stiffness is present in the body. The patient just can't able to walk also, but after some time he may walk on by taking some support. Okay, so the understand the psoriatic arthritis. To remember psoriatic arthritis, just remember the two things. One is the psoriasis, another is the arthritis. Just combine the two the symptoms of two diseases, then you will get the symptoms of psoriatic arthritis. Next, ma'am. Next slide.
Yeah, actually, it is taking a bit to change, bit
Okay.
time to change.
Okay. Okay, and the last type of psoriasis according to modern science is the scalp psoriasis. Here in the scalp psoriasis, we will find mild and almost unnoticeable changes in the scalp. The patient has the scalp psoriasis, but it is unnoticeable because it is very mild. But in severe cases, which last for a longer time, there the patient get the thick crusted sores. There is intense itching, and because of that itch the person's sleep is disturbed, and the day-to-day life is also hampered. The scratching of the head or the scalp, because in the scalp psoriasis there is extreme itch is present. The scales are there, there is a more dandruff, there is more flakes, or the scales they are visible on the hair. Then uh, it may also catch the skin infection, and because of vigorous itching of the scalp the patient may lose their hair also. The symptoms here are in the mild type of scalp psoriasis. It will have very fine scaling, simple mild dandruff like symptoms you will see, and there is a slight itching. But in case of moderate to severe type of scalp psoriasis, you will see the scaly red bumps, small bumps you will find in the scalp, and the patches are present completely on the forehead or on the back of the ear, or sometimes on the temporal region also. And the patient also we will find the silvery white scales, and the main symptom here is the itch. The main concern part of scalp psoriasis is the itch. Because of vigorous itching only, there may be the there may be the extreme hair fall, and in that condition, that we have to treat it accordingly. In the modern science, we will give only the local applications or the lotions or the creams in the scalp psoriasis, but it won't give any of the satisfactory result. The scalp is extremely dry, itchy, scaly, and with burning and soreness. Next slide, ma'am. Okay, we'll come to the final conclusion of the modern part of the psoriasis. Till now, we have seen what is the psoriasis. It is an autoimmune disorder. I think the concept is clear to everyone about the psoriasis. It is an autoimmune disorder where your own immune cells try to kill your normal skin cells. In an attempt to repair it, your more and more skin cells are developed, and they come and they accumulate on the surface of the skin, leading to the plaques. Okay, which looks like the dry scales on the skin. And next is the causative factors. Exact cause of the psoriasis is unknown, but we have seen some of the triggering factors which precipitated the psoriasis. Next comes the signs and symptoms. It is same in every psoriasis. There is a skin, that is, you will have the patches on the skin, you will have the itching or redness or the swelling. It's a painful, sometimes it is associated with the burning sensation. And when it is a psoriatic arthritis, you will have the pain and the swollen joints. Okay, next, the different varieties of or the different types of psoriasis we have seen in detail. We have seen how it appears, and lastly is the treatment. In the treatment, just I want to clear you all that the exact treatment for psoriasis is not present. Okay, how they will treat the psoriasis in a modern size? They just try to stop the skin cells from growing so quickly and to remove the scales. That is the only thing they have in their hand to treat the psoriasis. Means they are just treating, or they just want to control the growth of the skin cells. For that, they are prescribing some of the creams, ointments, creams and ointments. In that, they have, of course, they have the steroids only. They use the steroids only, which controls the growth of the cell. And the light therapy or the phototherapy, laser therapy, some of the oral medications and the injections are also present, where they claim to treat the psoriasis, but just ask them, after taking these oral medications for the psoriasis, you won't get any side effect or no. Okay, there are so deadliest side effects are present of modern medications for the treatment of psoriasis. If the person who is taking that medication, if he read the side effects of that medicine, then he may stop taking the medicine immediately, because of course it may get subsided for some time, but it may give rise to a new disease, a new system may get damaged. Okay, so I think the modern part of the psoriasis is clear to everyone. Now let's start with our Ayurvedic aspect of the kushta. Okay, so we will not discuss in detail about the kushta, because it is a very vast chapter present in the Charaka Samhita, or most of the acharyas have explained the kushta, vyadhi. Okay, so here what is the paribhasha of kushta? Here, tvachah kurvanti vaivarnyam, dushtaha kushta mushanti tat. Okay, the shloka is taken from the Ashtanga Hridaya. What is kushta? Means the thing where there is a discoloration of the skin. When the skin becomes, the cells of the skin becomes vitiated, the doshas become vitiated, the tvacha kurvanti vaivarnyam. Vaivarnyam means there is a discoloration of the skin, that is called as the kushta. So any skin disease in Ayurveda, we consider it under the kushta. It may be any disease, any of the skin disease. So many skin diseases are present. All those skin diseases we can treat it, or we can treat it as a kushta only. I think the kushta paribhasha is clear. It is nothing but the any discoloration in the skin is called as the kushta. Next is the nidana. Very important thing. Very important, because for the treatment aspect, first we should ask the nidana of the patient. Okay, if you won't ask, if you won't take the history of the patient, if you won't find the nidanam, just you go on treating the patient with the medication. There are lots and lots of medicine are present for the treatment of the kushta, without exact diagnosing the disease, without exactly not knowing about the dosha samurchana and the nidana. If you just go on giving the prescription or the medicine, the patient will not get the relief. Okay, so sometimes some young doctors, they may get disappointed that, okay, that doctor has given the same medication and I am also giving the same medication, but my patient is not getting the relief. Okay, why this happens? This happens because of improper taking or improper understanding of the disease in a Ayurvedic way. So in Ayurveda, very more important is given to the nidana. Here the shloka Viruddha Annapanani means the person who consumes the Viruddhahara. Viruddhahara in the sense what? If the person combines the two unwholesome diet. For example, very commonly, if we see, that is the Madhu and the Ghruta. Very common example, everyone knows, that is the Viruddhahara. When these two Madhu and Ghruta, they are combined, they produce a toxin in the body which may lead to the Kushta Roga. This is a simple example. So another thing, if a curd, another example Viruddhahara is, if a curd is mixed with the fish, okay, fish and curd are mixed, and if they are cooked, and if the person take that kind of food on a regular basis, then that may also cause the kushta to occur. Okay, drava snigdha guru nicha, excess intake of the drava snigdha guru ahara, bhajata magatam charti vegas chanya pratitnatam, means if the person suppresses or if he controls the urge for vomiting. Okay, veg dharan for chardi. Okay, when chardi ke veg ko rokna, that may also cause the kushtha. व्यायाम अति संताप अति भुक्तवोपसेविनम. If the person does vyayama or he get exposed to excess of heat immediately after taking the ati bhuktvo ati ahara or the ahara up to full of his stomach after taking the food, and if he does the vyayama and if he goes out in the extreme sun, then that may also cause the kushta. शीतोष्ण लंघनम आहारान क्रमम मुक्तो निषेविणाम means here taking the cold items immediately after taking the ushna items or the ushna food, ushna quality of food, and after taking ushna quality of the food immediately the patient is taking the shita quality of the food, means hot beverages and the cold beverages if they are taken followed by each other. Next, the aharam krama muktva nishevinat, and also langhana. After langhana, taking the heavy food immediately after following the fasting or the langhana, and that may also see these all factor they are vitiating the agni. Okay, so agni is only the responsible factor for the onset of the many of the diseases according to Ayurveda. Dharma shrama bhayartanam dhrutam shitambu sevinam. Here, dharma shrama bhayartanam dhrutam shitambu sevinam. Shitambu sevinam. Shita ambu, that is taking the cold water immediately after exposure to the extreme sunlight or extreme heat. Shrama, exertion, or bhaya, fear. So, when the patient undergoes this regimen or this factor, that is बाहर से इमीडिएट आना और ठंडा पानी पीना, या फिर एक्सर्शन, इमीडिएट एक्सर्शन के बाद आप कोई ठंडा पानी पीता है, या फिर भय, फियर. In fear, the most of the they ask for the water, and if it is cold, that also a nidana for the kushtha. Next is the achirna adhyashinam chaiva panchakarmapacharinam. Here achirna, that is the uncooked food, if the food is not cooked properly. Adhyashana, okay, or the unwholesome food, or the food which is, or the person has taken the food, eaten the food just immediately after the previous food is not digested, and a panchakarma upacharena, means the food which is restricted during the course of panchakarma. In all these conditions, if the patient takes the ajirna adhyashana, if he takes the food unwholesome, improper, if the food is not cooked properly, and if the previous food is not digested, then immediately he takes another heavy meal, and at the time of panchakarma we say some of the restrictions that should be followed by the patient. If the person doesn't follow those restrictions, then also the person may have the kushta roga. Navanna dadhi matsya ati lavana amla nishevina. So here the new grains, dadhi, matsya, tila, amla, means excessive intake of all these things. Masha mulaka pishtanna. Masha is, the black gram. Mulaka pishtanna is the fermented food. Excessive intake of masha mulaka pishtanna. Tilak kshira guda. That is sesame seeds, kshira guda, etc. In excessive quantity, if we take all these things, that may also precipitate for the kushtha. Vyavayam chapya jirne anne nidram cha bhajatam diva. Here, but if the person has indulged in the sexual activity immediately after taking the food, nidracham bhajatam diva, after taking the food, if the patient have the diva swapna, then also that is a factor. Vipran gurun gharshayatam papam karmam cha kurvatam, means if the person, if he insults his gurujan, or if the person insults his gurus, brahmana, or some of the respected or respectful persons in the society, and also the papa karma, these are all the nidana in the kushtha Vyadhi. Okay, the nidana is very important here. Every disease, every skin disease, when you try to treat any of the skin disease, you should remember these nidanas. It is not only meant to stay in your text or in your just for, don't read it only for the exam purpose, but when you enter into your practice, everyone should follow. You just ask whether the person is continuously, whether he is taking the viruddhahara, or whether the just he is taking, or he takes the heavy food and he go for any gym workout or what, whether he just immediately after coming from the outside, whether he is taking the cold water from the fridge. These simple nidana you have to ask to the your patients, then only it will be very easier for you people to treat the patient. Next, ma'am. Next slide, please. Okay. Next, the very important thing, that is the samprapti of the Kushta Roga, how the Kushta Roga occurs in the body. वातादयस्त्रयो दुष्टस्त्वक् मांसाम्बुच दुष्यन्ति स कुष्ठानां सप्तको द्रवसंग्रह अतः कुष्ठानि जायन्ते सप्त चैकादशैव च न चैकादोषजं किञ्चित् कुष्ठं समुपलभ्यते. So here kushta samprat vatadayas dushtam means here there is a visheshan vatadi three doshas. Okay, and twak rakta mamsa and ambu. Three doshas and four dushas are responsible for the onset of Kushta Roga. Vatas Daya Trayo Raktam. Okay, so Vatas Dayo Dushtatvak Raktam. There is a visheshan of Vata, the three doshas, and also the Tvak Rakta Mamsa Ambu. All these seven factors, they are called as the Dravya Sangraha in the Kushtam. Okay, atah kushtani jayante sapta chaikadasaiva cha. So all these seven factors, when they have the dosha dusha samurchana, then they may lead to the 18 type varieties of kushta roga. Here, what exactly happens, how the samprapti occurs is, the person takes the nidana. There is a nidana sevana. It may be aharaja, viharaja, acharaja, any means any nidana if he takes for a longer period. So because of the nidana sevana, first of all, what happens is the agni mandya, the agni get hampered. Because of the agni, there is a amodpati is present in the body, and amodpati lead to the visheshan of the three doshas. These three doshas causes the dhatu shaithilyata, and further when the doshas get prakopa, or when there is again more visheshan of the doshas, they take stan sanshraya in the tvakka rakta mamsa and ambu. Okay, so निदान सेवन के बाद अग्नि मांद्य होगा. After अग्नि मांद्य there is a आमोत्पत्ति. आमोत्पत्ति, it blocks the channels. Because of that the doshas get vitiated. Those vitiated doshas, they causes the dhatu shithilata in the body. The dhatu shithilata, when it gets worsened, when there is again more prakopa of the three doshas, they just dislodge from their normal side. They go and take stan sanshraya or their place in the tvakka rakta mamsa and ambu, and there occurs the dosha dusha samurchana, that is the three doshas and the four dhatus. They have the combination of dosha dusha. Those dosha dusha samurchana leads to srota dushti. Then after they get lodged in the particular parts of the body, and they lead to the 18 types of kushta roga. Okay, I think the samprapti is also clear. Samprapti vighatana, here we have to break the samprapti vighatana for the treatment. Purva rupa of the kushta roga, sparsha adnanatvam, that is there you will won't find any of the sensation on that particular patch. Okay, suppose if the person is presented with the several patches on your body, there you just take a pen or just any pin, just touch that part, the person won't feel any of the sensation. Atisvedo nava vaivarnyam unnati. That is atisvedo nava. There may be excess perspiration. The person may sweat on that part or he may not sweat. Okay, Vaivarnyam, perspiration, or there is no any perspiration on that particular affected skin. Vaivarnyam is discoloration of the skin, and there may be the Kothani. Kothani is appearance of the rashes on the person's body. Lomahर्षश्च, horripilation Kandustoda Shrama Kumaha, Vrananam Adhikam Shulam, means there is excessive pain in the ulcerated wound. Vrana means it is a wound. Adhikam Shulam, there is a severe pain in that wound or the Vrana. Shigrotpatishchira Sthitam, that is, there is delayed healing of that wound also. Daha Suptangata Cheti Kushta Lakshanam Agrajam. So these are the Daha and the Suptangata. These are the symptoms, that is premonitory symptoms of the Kushta Roga. With these symptoms, you should able to diagnose that, you should able to understand that the person may get in future the Kushta Roga. Next slide, ma'am. Okay. Next is the Kushta Bhedas. We know the Kushta is broadly divided into two types. That is a Mahakushta and the Kshudra Kushta. Mahakushtas are 7 in number. Kshudra Kushta are 11 in number. Here, our only point of concern is related to the psoriasis. So we will vomit the extra psoriasis, types of the kushtas. Just we will take the important one, which is the symptoms which are we can relate it with the psoriasis. So in the Mahakushta, we have only one type of kushta, that is the Siddhma kushta, which have the symptoms similar to the psoriasis. And in the Kshudra kushta, we have Eka kushta, we have Charmakya, we have Kitima, and we have the Vaipadika. Okay, those 4 Shudra type of Kushta, and one is from the that is Siddhma Kushta. Those symptoms are correlated with the psoriasis. So the other type of the psoriasis we will not discuss here in detail. Next slide, ma'am. Okay, the Siddhma Kushta. Siddhma Kushta, here the person complains of, that is Shvetam Tambram Tanucha Yad Dvejam Prushtam Vimunchati Alabu Pushpa Varnam Tat Siddhmam Prayena Cha Urasi. So in the Siddhma type of Kushta, the person presents with the patches which are white and coppery red in color. Coppery in color. Okay, in the Siddhma Kushta, see, there are the patches, okay, and they are white in color. There are some coppery red, means white and coppery red, the mixture of white and coppery red. The same you can see in the plaque psoriasis also. The patches are thin, leaves out the dust like powder on rubbing. Okay, Prushtam Vimunchati, that is, when you rub that patch, the person, there is a dust like powder which leaves the skin. The whole appearance of the disease, it looks like the Alabu Pushpa. Praena cha urasi, the Siddhma Kushta, it is usually found on the urasa, that is the chest part. Okay, so Shruta, he mentioned this disease, that is Siddhma, in the Kshudra Kushta. I think the Siddhma Kushta is clear. We can compare the Siddhma Kushta to the plaque psoriasis only, because here also you can find the Shvetam Tambram Tanucha, means the patches are white in color, they are Tamravarna, they are Tanu, they are thin, and it just leaves the dandruff like powder when you rub the skin. Okay, and another important symptom, the point here they have given is that it looks like the Alabu Pushpa Varana, uske one ki tarah dikhega, and its main site of location is the Urah Pradesha. Next slide, ma'am. Next slide, please. Mridu, ma'am.
Yes, yes. Is it not moving?
No.
It's on which slide?
Next slide, ma'am. It's Siddhma Kushta only.
Okay, I'm changing it. Wait, I'll do it again. You want the egg kush slide, hai na?
Yes, yes, yes.
Now it's visible.
It's now general guidelines for the diagnosis. It's the next slide.
Okay, I have changed it. It will just come.
Previous one. Ma'am. Yes. Okay, so the next type of Shudra Kushta that we compare it to the psoriasis is the Eka Kushta. So in the Eka Kushta, the symptoms that we see is Asvedam, Mahavastu, Yan Matsya Shakalopamam. Means in the picture you can see clearly it's Matsya Shakalopamam. That is, it resembles the scale of the fish. Okay, the skin of the person, it appears fishy. The scales, they are just like the skin of the fish. It is thick and hard. It is asveda. There is no any perspiration present on particular part where you have this patch, and the location is Mahavastu. Mahavastu means it is extensively spread on the surface of the body. Okay. Next is the Charmakya. Charmakya or the Charma Kushta. We can call it as also call it as the Charma Kushta. Here, Taded Kushtam Charmakya Bahalam Hasti Charmavat. So here it becomes in this type of Kushta. Here the skin becomes thick like the elephant skin. Okay. So the skin of the patient, it becomes very thick, hard, and uh, very hard, and just like the appearance of the elephant skin. Recently, I have came across one patient, one of my own patient, who has this type of psoriasis. That is the charma kushta. Charma means his skin is so hard. I think it's more than 5 to 6 mm harder. Very parushvatam, very hard, very dry, and he presented with a severe itching and discoloration of the skin. So we can correlate the charma kushta to the one type of psoriasis also, where there is more thickening of the skin is present. Okay. Next slide, ma'am.
I think the connection is slow. I have changed. It may take some time.
Okay, okay, no issue. Okay. The next type of kushta that can be compared to the psoriasis is the Kitiba kushta. The Charakacharya, he used the word kitima. Okay, it is called as the kitima, and according to the Sushruta and the Vagbhata, they called it as the Kitiba Kushta. Here we will get Shavam Kin Kharasparsha Parusham Kitima Smrutam. Okay, so the patches, they are exudative, round, thick, blackish brown in color. They have rough, very coarse in nature. They are dry and with present with severe itching. Kitiba kushta is also compared with the plaque psoriasis. In Kitiba kushta, there is extreme there is a severe itching is present, very dry skin, round colored patches is present on the skin, and they are very coarse and hard. Next comes the Vipadika Kushta. We can compare it to the Palma psoriasis. Vipadikam Pani Pada Sputanam Tivra Vedanam Cha. Just see the picture. This is the Pani Pada Sputanam Tvacha. Okay, means there is a extensively, there is a very excessive, the patient has the severe cracks in the hands and the feet with severe pain or excessive pain associated with the itching and the burning sensation. Okay, see, this is the extreme condition of the palmar psoriasis or the Vipadika kushta. Sometimes how it starts is just you will get the cracks on your palms and the soles. Okay, first you will have the cracks. When the person won't take the treatment in that condition, then the condition may become worsen, and this it may appear just like what you can see in the picture, that is a palmar psoriasis, which is very painful. The patient can't walk also, with associated with the severe itching and burning sensation. Okay, next slide ma'am. Okay, now let's start with our diagnostic guidelines for the Kushtaroga. Here, Sarvam Tridoshajam Kushtam Doshanam tu Balabalam Yathasvairlakshanam बुद्ध्वा कुष्ठानां क्रियते क्रियाः दोषस्य यस्य पश्यते कुष्ठेषु विशेषलिङ्गम् अदृक्तं तस्यैव शमं कुर्यात् परं च अनुबन्धस्य. So here very important shloka, very important thing they have explained in this shloka. Sarvam tridoshajam kushtam. Each and every type of kushtha is tridoshaja. Doshanam to balabalam. Okay, so depending upon the dosha predominant, the symptoms are manifested, and the treatment should be decided on the basis of the symptom, which is shown in the specific type of kushta. Okay, all the kushtas we know it, they are the three doshaja. Okay, so which dosha is predominant? First, we had to treat that dosha, followed by the remaining doshas. Okay, so according to its manifestation, according to the predominance of the dosha, which dosha has the predominance, that symptoms represents that particular type of kushta. Okay, and in the treatment aspect also, which dosha has become on the top level or on the higher side, first we had to treat that dosha, followed by the remaining two doshas. Okay, very simple or but very important shloka. Here just you had to treat the main dosha, which is predominant, which represent or which manifest the symptoms. Okay, but the associated dosha should also get treated afterwards, but you should treat the main dosha. Next slide ma'am. Here are the specific features of the dosha dominance, that is Vataja, Pittaja, Kaphaja type of Kushta. What are the symptoms? Means all the symptoms of Vata, Pitta and Kapha you can find in this type of Kushtas also. For example, Raksham, Shosha, Stodaha, Shulam, Sankochanam, Tata, Ayamam, Parushyam, Kharabhavo, Harshaha, Shava, Varnatvam, Cha. These are the symptoms of Vatika type of Kushta, where there is excessive rukshata is there, dryness is there, atrophy is there, the shula, sankocha. Meaning, I think no need to explain each and every word's meaning, because from first year you are reading these only. Just remember the shloka. These shlokas are also very important for the treatment point of view. That is, if the person complains of rukshata in the body, there is excessive the shula, sankocha, ayama, parushata, kharata, harsha is present, the discoloration of the skin is shava, aruna varna, then you should think that it is a vatika type of kushta. Next, if the person complains or presents with the these symptoms, that is kushteshu vata lingam daha raga parisrava pakah visro gandha kledas tata angapatanam cha pitta krutam. If the person presents with daha raga srava paka, okay, visra gandha foul smelling, kledas tata means something, kleda is present in that particular part, or the angapatana is there. Angapatana usually that is seen in some severe and extreme condition of the Kushtaroga. We will not discuss about that Angapatana here. Just in each and every type of Paitika type of Kushta, you will definitely have the Daha, Raga, Srava, Paka, etc. Lakshanas. And sometimes you will also have the Visragandha. Next, in Kaphaja type of Kushtha, If we see Shwaityam Shaityam Kanduhu Stairyam Cha Utsedha Gauravam Snehaha Kushteshu Tu Kafalingam Janturbhi Bhakshanam Kledaha. So these are all the symptoms of Kafaja Kushtha. See, what till now, whatever we have seen, the Ayurvedic points of Kushta, that is the Sidma Kushta, Charma Kushta, Eka Kushta, Charma Kya, or another one, that is the Vaipadika Kushta. Those all varieties of Kushta, they are Vata Kafaja. Okay, so Vata Kafaja type of Kushta, they are easy to treat. Easy to treat means they are a Sukha Sadhya. Also, when the Kushta is present in the Tvaka, Mamsa, Rakta and Ambu, there also it is very easy to treat, or it is a Sukha Sadhya. When it gets deeper into the tissues, when it gets into the, that is Asti Majagata, when the doshas enters the Asti Majagata, it becomes Yapya, and that is Vata Pitta and Pitta Kapha. Okay, these are the Yapya. And when it becomes Tridoshaja, it becomes Asadhya for Chikitsa. So these points also you should remember. But when we are treating the Kitiva Kushta, Eka Kushta, those are Vata Kafaja and they are easy to treat. Okay. Next comes the principle of manage. Very important shloka. Very beautifully they have explained about the Kushta Roga, or the treatment of the Kushta Roga. वातोत्तरेषु सर्पी वमनं श्लेष्मोत्तरेषु कुष्ठेषु पित्तोत्तरेषु मोक्षो रक्तस्य विरेचनं च अग्रे. वातोत्तरेषु सर्पी वमनं. Okay, वातोत्तरेषु सर्पी. That's in case of the vata predominance of the kushta roga, we had to prescribe the snehapana. We had to give the snehapana. Vamanam shleshmottareshu kushteshu. That is in a kafaja predominance, we have to give the vamana. Pittottareshu moksho raktasya. In case of pitta predominance of the disease, and here we have to do the rakta mokshana and the virechana. Okay, so in the vatika type we have to give the sarpipana. In the shleshma type or the kafaja type, we had to prescribe for, we had to advise for the vamana karma. Pittottareshu moksho raktasya. That is in the pittaja variety, we have to ask for, in the pittaja we have to ask for the rakta mokshana and the virechana. Okay, vamana virechana yogaः कल्पोक्ताः कुष्ठीनां प्रयोक्तव्याः प्रचन्नम् अल्पे कुष्ठे महति च शस्त्रं शिरावेदम्. वमनं विरेचनं योगाः कल्पोक्ताः means they have told here to use the vamana and virechana yoga, which are explained in the kalpasthana. Means kalpasthana, they have given 600 yogas have been given for the vamana and the virechana. From those kalpas you have to take the drugs for the treatment of the kushta roga. Prachannam alpe kushte. When there is less visheshan of the doshas is present, when the manifestation disease is less, then you have to do the prachanna karma with any of the coarse object. Okay, and when it is mahana, then you have to do the siraveda. Siraveda, when there is a sarvanga kushta is present, when it is acquired the larger part of the body, then you have to take the, or you have to do the siraveda. Okay, next bahudosha sanshodhyah kushti bahusho anurakshata pranan. See, so much beautifully they have explained here. Bahudoshaha sanshodhaha means when there is excessive vitiation of the doshas present in the body, we should do the shodhana karma. Okay, shodhana means, of course it is a panchakarma only, of course it is a vamana virechana only, we have to do in the psoriasis. Okay, bahudoshaha sanshodhyaha. Bahudosha, in bahudosha avastha we have to do the sanshodhana. Kushti bahusho anurakshata pranan means repeatedly we have to do the shodhana karma. That is because bahudosha avastha hai, so yahan pe we are doing the sanshodhana repeatedly. While doing the sanshodhana, we should protect the prana of the patient, because excessive elimination of dosha may cause the vitiation of vata, which may again bring out the weakness in the body, and sometimes it may endanger the life of the person. Okay, what we think, there is a bahudosha avastha, we will give the uttama shuddhi repeatedly every month, every 6 months, every year we will give the repeated shuddhi. Then what happens? There may be the endanger to the life of the patient. Why? Because of excessive elimination of dosha, there may be the increase of vata in the body. When the vata gets increased, the person may have the weakness. Again, if it is not treated, the vata is not treated in the kosha, then the life of the patient may be in trouble. Okay, that's why the Chakradatta, he has given a very beautiful shloka, that is the pakshat chardanam. That is, we should do the vamana karma pakshat, that is, in every fortnight we have to do the vamana karma, or every 15th day, or after every 15th day we have to conduct the vamana karma. Masat sramsanam. Okay, masat every month we have to advise the patient for virechana. Sransanam is virechanam. Trahatascha avapeedanam sheswasram. That is, avapeedanam masesravam mokshayat shatshu. Okay, trahanasta means every third day you have to advise the patient for the avapedana nasya. Okay, every third day the patient has to take avapedana nasya. Mokshayet shatshu, that is, the rakta mokshana should be done on every, means in every 6 months. Pakshat Chadanam means the Vamana should be carried out on every 15th day. Virechana every month. Trahat Avapedanasya. That is, every third day you have to ask the patient to take the Avapedanasya. Moksha Shatsu. That's every 6 months the patient, we have to do the Siraveda for the Rakta Mokshana. Okay. Next, after the Shodhana Karma. Okay, it may be the means koshte pravahite rakte. So here we should advise, after the shodhana karma or after the sira veda, we should advise the patient to take the sneha pana. Why? Because after the koshta shuddhi, the koshta of the patient is the site for the vata. Okay, शोधन हो जाने के बाद we had to ask the patient to immediately start the snehapana. There are many snehas or the krutas have explained in the treatment, so that we will discuss in the next slide. Here what they have told, after shodhana karma, after the rakta mokshana, we should advise the snehapana. Okay, so that the vata dosha, it may not get further in a prabal avastha, it may not go into the further avastha. Next slide, ma'am. Okay. The treatment principles of Kushtha, if we see, it is divided into 4 parts. Daiva Vapashraya, Yukti Vapashraya, Antah Parimarjan, Bahir Parimarjan. These are the treatment principles. Why the Daiva Vapashraya Chikitsa is indicated in the Kushtha? Because of the Papa Karma. Okay, you have treated from almost all the directions. You have given the shodhana, you are giving the medicine, but still the patient is not getting the relief. In that case, there may be the papa karma, purva janma papa karma. Because of that, the patient is not getting the relief. In that case, we are advising for the daiva vapashraya chikitsa, like a homa bali or mantra patana, etc., is advised for the patient. Yukti Vakashraya is again whatever means whatever plan for the treatment. Antah Parimarjan and the Bahir Parimarjan. In the Antah Parimarjan, again it comes the Shodhan and the Shamana Chikitsa. In the Bahir Parimarjan, again what we say, that is the Lepam or the Avasechana or the local application or the some Abhyanga also comes in the Bahir Parimarjan Chikitsa. Next slide, ma'am. Ma'am, am I taking more time? Shall I complete it fast?
No, it's okay.
Okay. The treatment modalities for the Kushtha is Means in this format we have to give the treatment to the patient. First is the nidana parivarjana. Means you had to ask for the nidana and you had to ask for the avoiding the things whatever the patient is taking which is precipitating the Kushtaroga. Next comes the very important is the Shodhana. In each and every type of Kushtaroga, we have to first advise the Shodhana Karma. In the Shodhana Karma, the Vamana or the Virechana, sometimes it is said that in the contraindication of the Basti, it is said that the Kushta is contraindicated. But sometimes we can, according to the condition of the patient, we can advise for the Anvasan Basti and Astapan Basti also. And Shamana Chikitsa, in Shamana Chikitsa, you will have varieties of Churnas, Kashaya, Asava, Arishta, Guti, Vati, everything is there that we'll discuss later. Rasayan, why the Rasayan? Because it is an autoimmune disorder and there is a bala of the patient is reduced. That's why we are prescribing the Rasayana for the nourishment of the skin and the Pathya Sevana. What are the Pathyas for the Kushtaroga? Next slide, please. Okay, so these are the Shodhana Dravyas that you will get the reference in the Charaka Samhita, that for the Vamana Karma, when the doshas are accumulated on the upper part of the body, especially on the chest, then you have to use these drugs, that is Kutaja, Madanaphala, Madhuka, along with the juice of Patola and a Nimba. Okay, these are the drugs that with the help of which we can conduct the Vamana. Next is the for the Virechana, that Trivruta, Danti and the Trifala. When you have the psoriatic patches or the Kushta Roga in the lower part of the body, then you have to adopt these drugs, Trivruta, Danti, Trifala, and some from other references also. We can, for the Virechana purpose, we can also use the Danti Ghruta or the Manibhadra Gula. For the Asthapana Basti, there we Brihati, Patola, Madana Phala, Yava, and Musta. And when after Vamana Virechana and Asthapana Basti also, when if there is a still accumulation of some of the doshas, so if you find any of the Prakopa of Vata, for the treatment of that, we can give the Anuvasana Basti with Madana Phala, Madhuka, Nimba, Kutaja, and Patola. See, here they have told only Vamana, Virechana, Asthapana, Basti, but here we have to follow the classical rules only. For Vamana, that is the first Purva Karma, Pradhana Karma, Paschata Karma, very important. The Sadhya Vamana or the Nitya Virechana, they won't give you the satisfactory results, because when the doshas have moved from the coast to Shakha, okay, already the doshas are present in the shakha, then just after giving the sadhya vamana or the virechana, nitya virechana, how you will remove the doshas from the kosha? First you have to bring back the doshas from the shakha to kosha, then they have to be removed from the nearest root. That's why for the treatment of the kushta roga, you had to adopt the classical methods of vamana, virechana and the basti only. Okay, next comes the important grutas, that is for the Shodhananga Snehana. For the Snehapana, we can use these type of, means these grutas according to its dosha predominance. When there is excess of rukshata present in the body, when it is diagnosed as a Vattika type of kushta, there we can advise the Gugula Tiktaka Gruta or the Brahmi Kalyanaka Gruta for the Snehapana. In the Pittaja variety, where there is Daha, Raga, Srava is present, we can advise for with Mahatiktaka Gruta, Panchatiktaka and Tiktaka Gruta. When there is excessive of Kandu and Snigdhata is present, there we can advise for the Aragvadadi Gruta, Aragvada Mahatiktaka Gruta. Means here we can take the Achasneha, we can take the Siddha Gruta, we can take the Yapya Gruta or Yapya Sneha also. Means we can come, sorry, not Yapya, it is Yamaka Sneha. Means we can combine one or two type of Sneha, and when there is more Bahu Dosha Avastha is present, we can use the Yamaka Trivrata type of Sneha also. In Kapha Pitta Pradhanyata, we can take where there is Daha, Kandu and Srava is present, we have to advise for the Mahakhatira Gruta or Patolatya Gruta. In Tridosha Avastha, Mahakhatira Gruta is advised for the Snehapana. Next, ma'am. Okay. In the Shamana Chikitsa, that is the Antah Parimarjana Chikitsa, there here we are prescribing the varieties of Ghrutas, Churna, Kwatha, Vati and Avalehas. Next slide, ma'am. In the Ghrutas, we can give the Mahatiktaka Ghruta, very important, Panchatiktaka Ghruta, Gugula Tiktaka Ghruta, Tiktaka Ghruta, Aragvadadi Ghruta, okay, or Brahmi Kalyanaka Ghruta. These are the important Ghrutas where you can use it as the Shamana Aushadhi. Means always when you give these Ghrutas, they should be given on an empty stomach. Okay. Next comes the Churnas. They are the Twachas. Twachas means here in the treatment of the Kushta Roga, all the means you will see the Mahakasha, that is the Kandugna Dravyas, Kushtagna Dravyas, Tvacha Dravyas, Varnya Gana, Mahakashaya, whatever we have in our text, those all drugs are used in the treatment of the Kushta. Tvacha hai, Kandugna, Kushtagna, and Varnya Gana, all are used uh, with which give the very good results. Okay, next comes the Kwathas, means here the Patola Katorohinyadi Kwatha, Patoladi Kwatha, Manjishtadi Kwatha, Aragvadadi Kwath, Nimbadi, Panchadikta Kashaya. There are so many Kashayas have been explained, but while prescribing the Patola Katorohinyadi Kashaya, it does the Rechana also. It means you should properly fix the dose of the Kashaya. Why? Because sometimes it may cause severe pain in the abdomen. When the patient starts taking the Patola Katurohinyadi Kashaya, the patient may have abdominal cramps, and that should be tackled, that should be explained to the patient. No need to get panic. It is because of occurring because of the medication only. Okay. Next comes the Gulikas or the Gugulo preparations that we can use in the psoriasis. That is Kaishora Gugula, Amruta Gugula. See, it is called as the AKT. That AKT in the A for Amruta Gugula, K for Kaishora Gugula, T for Trifala Gugula. Okay, these three gugulas, they play very important role. They treat any type of the skin disease or any type of the Kushta rogas. Okay, next Panchatikta Ghrita Gugula, Swayambhu Gugula, Sukshma Trifalavati, Kushta Kuthara Rasa, Sarvanga Sundari Vati, etc. We prescribe in the treatment of the Kushta. Okay. Next, ma'am. Rasa yogas here extensively used by all the practitioners, means very common medicine which is present in each and every prescription of the doctor, that is the Arogya Vardhini Vati and the Gandhaka Rasayan. Okay, Gandhaka Rasayan, it act as the natural antibiotic of, means it is our Ayurvedic antibiotic. Gandhaka Rasayan, any infection is present, any skin inflammation is present, there we had to advise Arogya Vardhinivati and the Gandhaka Rasayana, and the Rasamanikya also has very good results in the treatment of psoriasis. Next, ma'am. Asava Aristas, means here Asava Arista, what we use are the Khadira Arista, Gugula Tiktaka Arista, Lodhra Sav, Madhuka Sav, and there are a wide variety of Asava Arista are present in the market that can be used for the treatment of psoriasis. Next, ma'am. Okay. Next comes the Bahir Parimarjana Chikitsa. Here we are advising the patient for the labor. Labor means the affected part of the body. There we have to just apply the applications. Okay. That is, it may be the Dashanga Lepa. Ma'am, previous slide, please. Previous one. Yes. It is Dashanga lepa, which is mixed with the Gruta and it is applied on the affected part. Karanjadi lepa with Gomudra, Eladi lepa and Marichadi lepa. These are the important lepas that have given the beneficial results in treating the psoriasis. Next, ma'am. Malahara, that is in the ointment form, that is Gandhaka Malahara, Gandhaka Dhriti, Gandhaka Karpura or Sarjarasa. They are also applied on the psoriatic patches. Taila, very important, is the Karanja Taila, or because when there is a dryness, when there is a Vatika type of Kushta, then the Taila plays an important role. Mahamarichadi Taila or the Marichadi Taila or the Chakramartha Taila, Eladi Taila, they are very important. They give very good results. Next, the Kandugna or in the Vata, it is a Vata Kapha or when there is a Vata and a Kapha Visheshan is present, the patient is complaining of the excessive itching, then we can add the Bruhat Haridra Khanda, Laghu Sutta Shekhara Rasa, and also we can add the Yashti Madhu. When there is association of Daha, when the patient complains of severe burning sensation, there we can ask the patient to apply Chandanadi Taila, or we can ask the patient to apply the Shatadhuta Gruta, Yashti Madhu Gruta, which has the Sheetal properties, Mahatiktaka Gruta or the Panchatikta Gruta can also be prescribed. Next, ma'am. Next slide, please. Okay. And the last part of our today's webinar is some of the research articles which we will find in the treatment of the psoriasis. You will see, we just know whatever we have seen or whatever we have learned today, it is not only limited to the theory. Okay, so there are so many researches have been carried out in India and abroad also, where they are trying to treat the cases of psoriasis. You can see the case, that is the management of erythrodermic type of psoriasis through Ayurveda. Means that severe case is also managed with the help of Ayurveda. If you want, you just Google these articles, you will find it in the Google. You will get the confidence, you will have the confidence that you are the new budding doctors of our society, that you have the faith in Ayurveda. When you treat an autoimmune disorder, means you can treat anything. Why the psoriasis is curable with Ayurveda? Okay, why it is curable? Why, even though it is a autoimmune disorder, how we are able to treat the psoriasis? Means the repeated attacks of psoriasis we are means there is no repeated attacks, or there is no onset even after taking the medication, even after 4 or 5 years of stopping the treatment medications. Okay, why? Because it is a autoimmune disorder, but we are treating it with the Krumihara Dravyas. Krumihara Chikitsa we are giving in the psoriasis. Why the Krumihara? See, the Krumihara Dravyas, whatever the Krumigna Dravyas they have been explained in the text, they don't have only antimicrobial activity, but they give the power to the immune system of our body. Krumignata, that is, it gives the strength to the immune system. That's why we are able to manage the psoriasis. Okay, here we are giving the Krumihara Chikitsa. Also, this one point I forgot to mention. That is, we are able to treat with the help of Krumigna Dravyas also. Another thing, in case of stress-related psoriasis, if or the scalp psoriasis, or when the complete body is acquired by the plague psoriasis, there we just do the Takradhara. Okay, the Takradhara is alone able to control the stress, and because of when the stress is controlled, the psoriasis get relieved on its own. Okay, the scalp psoriasis or the plaque psoriasis or some other type of psoriasis, just advise the patient for the takradhara. Okay, all the symptoms will get subsided. The doshas, if you want, then you can advise the patient for the shodhana karma. Along with the shodhana karma, advise the patient for the shirodhara also. In that, the takradhara gives a very good results. Practically seen, we have seen that after the takradhara, the patient has got relief within 21 days. Okay, his skin has become completely normal after the shirodhara. What we are doing there, we are managing the stress, because stress and psoriasis, they both work hand in hand. जब आप psoriasis को ठीक करना चाहते हो, पहले उसका स्ट्रेस फैक्टर आप ठीक करोगे, स्ट्रेस ठीक होगा तो आपका psoriasis ठीक होगा. Okay, I think I'm able to explain or in a very simple way. I think it's understood to everyone. Yes, if you have any doubts, then we'll have a discussion.
Thank you very much, Dr. Asma. It was a very informative session and a very clear concept of psoriasis is explained by you. If anyone has any query, feel free to ask.
Doctor, good afternoon. Hello?
Yes, sir.
Hello?
Hello.
Madam, diabetic underlying cases, psoriasis can be controlled with our system of medicine, madam?
Yes, sir. If the diabetic is controlled and if the patient is taking the medication, if the sugar level is under control, then we can able to treat the psoriasis, sir.
Okay, since long back, I am seeing many cases, they are recurrently having the same complaint. At our giving our medicines, they are getting relief.
Yes,
sometimes
sir,
they are going for modern medicine.
Yes, sir. For that's the reason only they have told you to do the shodhana karma repeatedly, because we cannot treat
Yes.
the disease at a time. Every month or every
Yes,
6 months or every year, we have to do the shodhana for these type of people, sir,
Okay.
who is having the repeated attacks of psoriasis.
Okay, okay, doctor. Thank you. Thank you, doctor.
Thank you, sir.
Okay.
Thank you, Dr. Asma.
Thank you,
I
ma'am.
think that was the only query. Thank you very much for joining us and accepting our invitation. Yeah, there is one more question.
More query, doctor.
Yes.
Yeah, in case of scalp psoriasis,
Yes.
is itching a major cause of like if you have fungal infection, and
Yes.
is itching a trigger for psoriasis in case of scalp psoriasis?
Itching is the main symptom of the scalp psoriasis. There is a vigorous itching. There are the small bumps present on the scalp, and you will have the dandruff-like appearance. Scales are present on the scalp. See, the
Okay.
fungal infection is different and the scalp psoriasis is different. Just try to make out a difference between these two conditions. In a fungal infection of the scalp, there you will have the loss of patchy hair. Means you will have developed the patches on your scalp. Means it will completely, there will be the loss of hair on that particular part where you have the fungal infection. Okay. But in the scalp psoriasis, because of vigorous itching, you will have the hair fall, but there is no any development of the patch on the scalp.
But in that case, will we have to treat fungal and psoriasis both together?
That only I am saying you have to first rule out whether it is a fungal infection or whether it is a psoriasis.
Means fungal infection will not be the underlying cause for psoriasis.
No, that is not the cause. That is a different concept only.
या मैं जस्ट पूछना चाह रही थी कि इसमें हमें फंगल ट्रीटमेंट नहीं देना चाहिए, कोई एंटी फंगल वगैरह का कोई रोल नहीं है इसमें, जो सोरियासिस फंगल इन्फेक्शन की वजह से हो रहा है?
No, if you have a scalp psoriasis, then there is no any use of giving the antifungal drugs there. There is no.
Thank you, ma'am. Thank you.
Okay.
Okay. Thank you. Thank you.
Okay.
Thank you, Dr. Asma. Thank you for joining.
Thank you so much, ma'am. Thank you for giving this me opportunity to speak in front of you all. I also thank our beloved principal, sir, Dr. Manjunath Gavimat sir for giving me this opportunity and for making the necessary arrangements for the today's webinar. I also thank the Archana Pancheshwari Mat ma'am for always motivating and helping me and the smooth conduction of the webinar. Thank you so much, ma'am. And all
Thank
the
you.
associated staff, everyone, I thank you from the bottom of my heart because this is my first webinar, I think. And I hope everyone has got understood from this. They have
Yeah, it's very informative and it doesn't look like it was your first webinar.
thank you so much.
Okay, this will be available on YouTube and we'll be sharing link soon when it will be uploaded. Thank you everyone for joining. You can leave the meeting now.